Okay, so we are going over oral care today for our ventilated patients. And so it's important to be doing oral care every 2 hours. We're trying to prevent VAP or ventilator-associated pneumonia, so we're just trying to keep the patient's mouth clean, get rid of any bacteria that might be building up in there, any secretions that they have built up in their mouth, since those are coming up, they can't really cough them up. So we're just trying to make sure that we're keeping our patients as healthy as possible. So you'll open up the first packet and it'll have some suction pieces in there. Of course, the first thing that you do when you enter the room is wash your hands, put on gloves, and then you'll have this Y piece that'll connect so you can have 2 sets of suction tubing going at the same time. It has this kind of like little control that has your on and off switch that'll connect to your suction tubing, and then all of the little pieces connect to the top of this. So this is a nice little suction piece that has this bag that goes over so we can keep this clean. It's not just laying in the bed and getting dirty and then getting stuck back in the patient's mouth. So first thing, go in, suction your patient's mouth out, get any secretions that might be in there, and then grab your first kit. And the one that I have here is a toothbrush that goes on here, and then so I'll just dip my toothbrush in my little package of toothpaste here, and then just go through the patient's mouth, brush their teeth. You want to be gentle, but of course you want to make sure that you're getting the plaque and stuff off of their teeth. So making sure you're going all the way back and getting their molars, brushing in little small circles, top, bottom, left, right, inside of the mouth, getting their tongue, their gums, their cheeks, all of that, making sure that you're keeping it nice and clean. And then I have this little green swab and some mouth moisturizer. So I'll put the mouth moisturizer all over the swab and just go making sure I'm getting their cheeks and their tongue and their gums, just keeping their mouth nice and moisturized so it doesn't really dry out and kind of grow that bacteria. So then leave and come back in 2 hours, open up your next kit, and it looks like the one that I have here is this section. So with this, I can reach a lot farther into the back of the patient's throat than I can with this. So this, I can go kind of down alongside of their AT tube and get any secretions that might be kind of building up around there. And just going further back and making sure, again, that we're just keeping their mouth as clean as possible. Put this back on, suction it back out, come back in 2 hours and grab the next kit. Then I have this little green foam suction here that I have with this it's kind of like another toothpaste that I'll dip this in, swab out the patient's mouth, making sure I'm cleaning it, then turn my suction on and suction it out through here. And then, of course, again, same thing as the end, it comes with this green swab and some mouth moisturizer, making sure that we're keeping their mouth nice and clean and nice and healthy.